and streaming on smart devices everywhere. Not to say that Dr. Kevin Kavanagh is, shall we say, competitive, but we have Dr. K with us right now, who tells us via his email. Good morning, by the way, Dr. K. How are you?
Well, good morning, Jack. I'm doing great.
You tell us by your email that the CDC now warns of the new variant BA.2, but we did that last Monday. Who's counting, right?
That's right. Who's counting? Who notices? Yes. Well, we've been ahead of the game on many items, including the Delta variant, wearing masks.
Yep.
We've done well here, I think, overall.
I think we have too.
If people followed us over the last 2 years, I think they can decide who gives out accurate information and what news outlets maybe not so much.
So tell us about the BA.2. What do we know about it at this point?
About the only thing we know for sure is at least 1.5 times as infectious. And as we've discussed before, infectivity is as much of a problem as disease severity when you catch the virus, because what determines your safety when you do an activity is getting the virus, and then if you get the virus, how well you do with that virus. So both are important factors. We're not yet sure whether or not it can escape immunity. There's some reports that say yes, some reports that say no, but most of the reports are putting the disease severity equal to that of Omicron. So we may be just in for more of the same, but as you've seen, our case rates in Kentucky, the number of people that are getting sick and dying, more of the same really isn't acceptable. We need to up our game, wear masks, social distance, get takeout. All of this is important to try to mitigate the spread of the virus so that our healthcare systems and primary workers are not overrun with this disease. Because if that happens, it doesn't matter if Omicron is severe or not. If the hospitals are packed, then all of a sudden you can't get seen really quickly for your heart attack or your stroke. And that's the situation we're in right now.
Tell us about the U.S. Army and Duke and what they're teaming up and working on.
Yeah, this is really, I think, very interesting and very hopeful. And as probably a lot of the viewers are picking up, that with variant after variant after variant, these vaccines to be doing well, not so good. Will it do better? Probably not. And it gets pretty frustrating. And maybe we're going to get out a booster. Maybe that'll work. Booster, by the way, is being worked on for Omicron to be out sometime before summer, but now we've got a subvariant of Omicron. So what this type of a research project that involves the Army and Duke independently is working on this project is trying to get a vaccine that works on all coronaviruses, possibly even the cold, who knows? And this work is coming out of an observation that with SARS-CoV-1, there is one antibody that also works for SARS-CoV-2. Now, SARS-CoV-1 was the deadly SARS that occurred back in 2003 that didn't spread very fast, so it just kind of died out. And what they're doing is trying to make a vaccine around this antibody that still works, and they think it's because it is targeting a portion of the virus that virus needs to be infective. In other words, a key component to its attachment to the ACE2 receptor. And so if indeed that is true, then these vaccines may cover all coronaviruses. And I think that's very exciting. For those that are kind of nerds like myself, the protective antibody they're looking at is DH1047. And the type of vaccine are nano-spike protein vaccines. Nano means really small, like nano-particles and nanorobots that you see on sci-fi movies, etc. And the spike protein vaccines is they take kind of a glop, kind of a sticky glop, and put little particles on it that are to elicit the antibodies. So this type of vaccine isn't injecting mRNA into cells, it's using an actual glop of material and giving the key viral component that the body needs to elicit its immunological response. So I think this is very exciting news, and this is what I'm very hopeful for. I think earlier last year we mentioned the Army program a little bit, but they were just at the beginnings, but they're in phase 3 trials now. So it looks quite hopeful.
That's exciting. I like to hear good news. We all like to hear the good news, and we like to hear it straight too. If it's not good news, we need to hear that too. But I like the fact that you kind of got a little bit of both this morning. Dr. Kevin Kavanagh, always a pleasure, sir. Thank you.
Thank you, Jack. Bye.